Welcome, Sean, with Intermountain Healthcare. Can you tell us a bit more about yourself and Intermountain Healthcare?
Hi, Gary. Thanks for the invitation to participate today. So I'm Sean Davis. I'm the Assistant Vice President of Business Applications at Intermountain Healthcare. I lead the team that has responsibility for the technology that supports finance, supply chain, HR, and payroll. And I've been with Intermountain for the last 18 years. A little bit about Intermountain. We're an integrated healthcare system based in Utah. We're 24 hospitals. We have a medical group that has 160 clinics. We employ over 2,400 physicians and advanced practice clinicians. We have a health plan called Select Health, and we employ about 40,000 caregivers whose mission it is to help people live the healthiest lives possible.
Sounds amazing setup you have there. Obvious question, how has COVID impacted your business, and has being on the Oracle Cloud helped you during this time?
Yeah, I mean, as a healthcare organization, we experienced some of the same impacts that other healthcare systems have experienced since March. And obviously, we still continue to experience and learn new things, and as we've had to quickly pivot to address the needs of COVID and to keep our communities and our caregivers and our patients safe. Some of the things that have impacted us that I would highlight are, in March, we had to defer elective procedures. We had to redeploy thousands of caregivers to other roles, many of which were supporting COVID. We've, had to quickly pivot a lot of our delivery model to providing online healthcare, and that was supported by past investments that we had made in online healthcare on our Connect Care platform, so people can receive 24/7 online healthcare on their phone, on their computer, on their tablets. We also, like most organizations, had to transition a lot of people to work from home, and so we had about 10,000 people that are now working from home. But I was glad that we had transitioned to OCI before COVID and are running, the latest version of PeopleSoft Finance and Supply Chain. A little bit about how OCI has benefited us since we made that transition. We put an increased focus on supply chain technology to make sure it was performing well and it was highly available. We put a lot of focus on our supply chain processes to make sure that our patients and caregivers had the supplies they need to meet the needs of COVID. During COVID and being on OCI, we implemented a lot of automated monitoring so that we could get in front of problems before they occur and that they could automatically be resolved before they became an issue in production. So that was very helpful. Being on OCI, we're seeing increased performance, so our end users are seeing better performance when they're transacting in the system, and we're also seeing improved reporting. One other thing I would highlight is we've also been able to quickly scale our solution. We recently acquired a new organization, and just last month we were able to bring them onto our PeopleSoft systems. And the system was able to scale and support that addition really easily. So overall, I'd say I'm glad that we had made the transition to OCI before COVID. It's able to handle our workload, it's been able to scale, and it's got a much larger team supporting us on infrastructure and on the applications.
Okay. It sounds like you and the whole team have been very busy, Sean, in this period, and done a great job adapting on that. Maybe you could give a comment on your transition, because I know you went through a unique process where it wasn't just a move, but you did some upgrades at the same time.
Yeah, so just for a little background, we implemented 18 PeopleSoft Finance and Supply Chain modules, the SOA Suite and OBIEE, starting in 2012. And we did that with Oracle Managed Cloud Services in a private cloud in the Austin data center. So we had 8 years of experience implementing, upgrading, and the daily run and maintain with Oracle. We began in about 2018 discussing some of the benefits of being on OCI and decided it was a project we wanted to take on in 2019. We also needed to do a PeopleSoft and People Tools upgrade and wanted to see if we can combine those 3 projects together, and Oracle was supportive of us in that desire to combine the projects. And so we started the project in about May of last year. I would say it was a very formal, very structured, very planned process. We set the goal of trying to accomplish it all in about 6 months from beginning to end, and also set a goal of trying to achieve it within our normal monthly maintenance windows, which was a very aggressive goal. We were assigned a very experienced project manager who we had worked with in the past. our service delivery manager, our current Oracle Managed Cloud Services team, our Oracle Functional Services team, product support, and our senior ACS management team that we work with were also very involved throughout the 6-month engagement. We performed 3 separate dry runs just to test the timing that we can pull it off in our normal maintenance window, and that we could resolve any issues before we moved it into production. So that was very helpful. And then we felt ready to go and cut over last November, and did it within our project timeline and did it within our normal maintenance window. We had about 2 to 3 weeks of normal stabilization where we made some minor adjustments to the software. But overall, I would say Oracle was a good partner to allow us to combine our projects together into one. And we were able to do it on time, and we were able to do it on our maintenance window, and we did not experience any major issues.
Yeah, congratulations, Sean. I think it just shows, for these projects to go well, that you as a customer need to put the effort into all the planning and testing and working with all the different parties. So congratulations on that smooth transition and upgrade at the same time. One last question. Now you're on Oracle Cloud. What's next for Intermountain Healthcare?
Yeah, so now that we're on OCI, we're starting to look at other opportunities. We're currently implementing monitoring for Applications Unlimited, so we're looking forward to the benefits that we'll receive there. We're also starting to work on a database upgrade, and we're ready to move on to the next image for PeopleSoft and the next upgrade for People Tools. And then now that we're on OCI, we're starting to look at some of the other service offerings that we can take advantage of, like Oracle Integration Cloud and some of the other AI tool offerings.
Thank you, Sean. A very inspiring story of how you reacted and adapted to the pandemic and relied on Oracle to support you. Thank you for the great work that Intermountain Health is doing to keep us well and safe. Thank you.
Thanks, Gary.